As we learn more about the coronavirus, scientists and doctors continue to put out more information or information they think can help us. And in many cases, more data and more time are needed.
But there are some studies out there that suggest links that, even if they turn out not to have a huge impact on COVID, could be really important for your overall health. ClickOrlando.com's Brianna Voles is here now for Kirsten O'Connor to ask a doctor about one of those links.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, Candace, a study done by the University of Chicago Medicine has found that when it comes to COVID-19, having vitamin D levels above those traditionally considered sufficient may lower the risk of infection. Another study found that 80% of COVID-19 patients were vitamin D deficient. I went to Dr. Rajiv Ball, an emergency room physician here in Central Florida, to find out if that's just a coincidence.
So vitamin D really hit the medical world in the 1920s when it was discovered that it prevented illnesses like rickets and other bone illnesses. It was then later discovered that it can actually help out with immune function, cardiovascular health, and even some cancers. However, there's some data that's out there that shows that the respiratory effects of vitamin D is a little dicey. With COVID-19, there was a recent study from the University of Florida that showed that people with vitamin D deficiency were also a little bit more prone to having more severe illnesses with COVID-19. There's many reasons why this very well could be the case.
So one thing that the study also suggests is that African American patients who are vitamin D deficient are actually 3 times more likely to get COVID. So is that true based off what you just said? It could be true?
Yes, there's definitely a potential that it could be true. Is there a true direct correlation with a large randomized controlled study? No, not as of yet. This was more of an observational or retrospective study that showed this connection. However, we do know that African American populations, the elderly, and people in nursing homes are more prone to having vitamin D deficiency. And those are also the same populations that are prone to having more severe illness with COVID-19.
So even if the correlations may not truly be there, Dr. Ball says it's important to get enough vitamin D on a regular basis to keep you healthy.
Vitamin D has shown to help out with multiple skeletal issues as well as immune function of the body. When you have normal or higher levels of vitamin D, the body has a greater ability to fight against some illnesses. Those include respiratory illnesses, some cancer, and even cardiovascular health.
How do we get vitamin D? I know you said go outside, get some sunshine. What are some other natural ways, or should we just look to supplements?
So getting your vitamin D levels checked with your primary care provider is definitely very important. However, getting a little bit of sunshine, especially in the state of Florida, is definitely important as well. That's an easy way that you can get vitamin D and actually boost your own immune system. Without a doubt, whether it affects COVID-19 or not, getting vitamin D is always beneficial and can definitely help you out with your health.
When it comes to vitamin D deficiency, Healthline says 41% of adults in the U.S. are deficient, and it's even higher among Hispanics at 63%. 82% of African Americans are deficient.
What are some symptoms of somebody who might be vitamin D deficient, but they're not sick yet? How can they suspect they might be vitamin D deficient?
The best way to figure out if you're vitamin D deficient is through blood testing. There are other signs and symptoms that you can see early on with the deficiency. One is being a little bit more tired and fatigued, getting sick a little bit faster, and even brittle bones. While these may not be obvious initially, the best way to really test out for vitamin D deficiency is through blood testing and working with your primary care provider for those details.
Well, besides sunshine, which doctors say you should try to get out in the sun for at least 15 to 30 minutes a day, you can take vitamin D as a supplement. But it's also found in a lot of foods like egg yolks, mushrooms, fatty fish like salmon, canned tuna. Some cereals, juices, and milks are also fortified with the nutrient. Of course, as always, if you have any concerns, make sure to contact your primary care physician.